right, before we dive in, I want to take a minute and talk about why we do this. Our mission at Voices on Main Street is to help local businesses grow their visibility, strengthen their influence, and build real authority right here in the community. We shine the spotlight, but it takes the whole Voices on Main Street family to lift them up. Right alongside that, we have something we call Voices for the Voiceless. And that's our commitment to support no kill, no research, animal shelters, rescues, and adoption facilities. The folks who are out there protecting animals that can't speak for themselves. So when you listen to the show, you're not just hearing of business stories, you're part of a bigger effort to give a real voice and real support to people and organizations that don't have a big marketing budget or a media machine behind them. And yes, if it sounds and looks like I'm reading some of this, that's because I am. I want to get this right for our guests and for our community and for the animals and organizations that we care about. Today, I'm sitting down with a good friend of mine, Dr. Pete from Leicester Spine and Wellness Center out in Leicester, Massachusetts. If you're anywhere in Worcester County dealing with pain, this is somebody you want to hear from. Pete and his team have built a reputation for helping people avoid unnecessary surgery, reduce chronic pain, and get back to their lives using advanced regenerative medicine, chiropractic care, and other natural healing approaches. And what I really love about Pete is he's not just treating symptoms, he's helping you understand why you hurt and what non surgical options are actually on the table for you. So today, we're going to dig into regenerative medicine, what it really is, who it can help, and how to know if it might be the right path before you say yes to major surgery or another round of pills. So, Pete, welcome to Voices on Main Street.
Thanks, Jack. Thanks for having me.
My pleasure, brother. So, I'll tell you what. Give us a quick version before we jump into the segments. How did Leicester Spinal Wellness get started? I mean, when did you know, hey, this is the kind of work I'm meant to be doing?
Oh, I started about as of May of this coming year, 2026. I'll be physically here for 25 years. Yeah, it's been a while.
Congratulations.
I graduated from Assumption College in Worcester, and then I went to New York Chiropractic College up in Seneca Falls, New York. And when I finished my degree there, I came back home to my hometown and started my practice. It used to be named Chiropractic Healthcare and Pain Management. And then in around 2015, I rebranded everything and we decided to call it Leicester Spine and Wellness Center because we're primarily focused on the spine, being a chiropractor and all. And recently, as of 20, let me think here. 2022, we got into, yeah, it was 2022, 2023, we got into regenerative medicine. Currently, the practice is integrated. I have a doctorate level nurse practitioner who comes in once or twice a week for a few hours to deliver services with regenerative medicine. He's been trained by a tissue bank out of Florida called New Life, where we get our product from. We get our stem cells from that particular tissue bank. They get the stem cells from donated placentas from women who have had, they're very healthy during their pregnancy and before, and they give birth to very, very healthy babies. And the stem cells are screened for viruses and bacteria and everything. So there's no pathogens at all in the stem cells. And they're basically multipotent mesenchymal stem cells. Initially, people got a bad rap about stem cells because when they started doing research with these types of cells, they weren't using the multipotent ones. They were using pluripotent. They could turn into anything, and doctors would have to put the patients on immunosuppressive therapy, and they would just turn into anything. There were people who are, they get an injection into their shoulder, and next thing you know, they had a teratoma inside there. It's a type of tumor that grows hairs and teeth and stuff like that. So the cells that we use, they're multipotent mesenchymal stem cells. They do four main things. Number one, they're highly anti-inflammatory. They get rid of the inflammation. And we've had patients tell us that it felt better than any cortisone shot that they've ever had. Number two, they have an enzyme that eats up scar tissue. So if you have scar tissue from injuries or post-surgical operations and stuff like that, it really helps get rid of a lot of the scar tissue and realigns everything. Number three, it will basically modulate the immune system. So if your immune system is overreacting in an area like a knee or shoulder or hip, it will calm it down. It'll disperse it out. However, if it stopped working in the area, it brings it back in so it finishes the job. But last but not least, the best thing about these stem cells is what happens is it kind of tricks your body into thinking it's decades and decades younger. So when we do the injection of the stem cells into the joint, what happens is as we age, the stem cells that we're born with, they go into retirement. They hang out in capillary networks. So by introducing these cells into an area, they bring these your cells out of retirement. So they start to divide and differentiate and turn into the cells and tissues that need to be replaced.
Wow, that's amazing. That's amazing. Okay, now, as you know, we've got a tradition on the show. We call it Pass the Mic. And each guest gets a question from the previous guest and then leaves a question for whoever sits in the seat next. The question that was left for you is this: what's one belief or mindset you'd install in every new business owner?
Pretty easy. If you're in debt, if you had to take out loans to get in business, focus on getting rid of that debt as fast as possible and then building up a war chest of, as much money that you need to cover 3, 6, or even a whole year's worth of expenses. So you don't, it takes just a lot of stress off of you. Also, another important thing is just to understand that there's cycles in business and that every business has a cycle and you're going to go up and down during the year over decades and stuff like that. Realize that the cycles exist and the best you can do is mitigate them. You're not going to stop them. So it's important to have that war chest to really help mitigate these cyclical patterns in business.
All right, folks, now it's time for our People Are Asking. And this is where we hit the questions people are actually typing into Google, asking their AI units, Siri or Alexa, before they ever walk into a regenerative medicine clinic. Now, we've got 10 of them. We're kind of looking for short, clear answers. They're perfect. If you go a little deeper, that's fine. We'll land each one with a quick bottom line so folks listening have something simple to take away. Uh, though it's a big topic, obviously, but what's a simple answer, Pete? What exactly is regenerative medicine?
It's basically using your own body's natural products, like with the platelet rich plasma. And it became a household name back in 2011 during the Super Bowl. Pittsburgh Steelers, Heinz Ward and Troy Polamalu, they had some major injuries. And so what they did was they used platelet rich plasma and they took blood from the athletes, they centrifuged the blood, and then they concentrated all of the plasma, the growth factors, and platelets. Platelets are famous for wherever they are, draws the immune system in. So it helped accelerate their healing because they were out, a week before the Super Bowl, and they both were able to play. And they ended up winning the Super Bowl because they were the two main players. So it basically regenerative medicine, and it's been around. It dates back even 100 years or so, where there was a doctor who had a patient who had some very bad burns, and it was crude. He wrapped the placenta around the burn area, and it healed because of the stem cells that were in it. So basically, we're looking to regenerate tissues. Mostly, we want to regenerate cartilage. We want to regenerate tendons. We want to regenerate all those components to kind of rebuild and kind of wipe away 20, 30 years worth of damage out of a joint.
All right, and that I like the reference to the NFL. I mean, that's amazing they were able to do that. Um, So, and you kind of touched on my next question in that, but can you give me kind of what conditions can regenerative medicine help with?
Oh, osteoarthritis, post-surgical type of scar tissue buildup. Basically, people who have had injuries and stuff like that, anywhere from acute to chronic injuries. When we get into, you know, what they can really treat out of this country, it's amazing. It's absolutely amazing. We can only deal with basically large joints and spines and stuff like that. We can help people. We had this one patient who had pulmonary fibrosis, and we had her, go and we had her nebulize the platelet-rich plasma, and it really helped, the condition with her lungs. We could do a lot of stuff like that in the States. You go out of state, you go into like Costa Rica or Colombia, where Infinity Medical is. The stem cells that they use down there are fresh, and there's a big difference as far as that go. But they're treating neurological symptoms. They can actually reverse multiple sclerosis. They can reverse type 1 diabetes. They can reverse rheumatoid arthritis because it modulates the system so well, the immune system so well. It'll actually stop the monoclonal T cell aberration from happening, and it'll reverse a lot of the problems. If it's type 1 diabetes, it'll restore the islets of Langerhans and the pancreas. If it's rheumatoid arthritis, it'll restore the articular cartilage. If it's multiple sclerosis over time, it'll help restore the myelin sheath. When they start doing stuff like that, down in Costa Rica. In fact, I'm affiliated with T.R. McManus, who owns both of them. And he says to me, I basically have a call with him once a week. And he's looking for patients that need their heart valves replaced or their kidneys are almost shut down or whatever. They can rebuild stuff like that. They can really
Well,
regenerate almost anything that has been really broken down.
right. I guess so. Your answers always lead into my next question. So, does regenerative, what they're asking is, does regenerative medicine actually work?
It works very well. There's a 80 to 85% success rate. What we're looking for when someone comes in for a treatment, or not even a treatment, but to just see if we could help, just to see if they're going to be a potential candidate or not. We have to do an x-ray and see what kind of real estate's left in the joint. If you have a joint that's fused, or if it's really bone on bone that's fused, then we can't help you. If there's still a tiny bit of cartilage in there, you just need that little bit of soil to throw the seed on. And then, once the cells get in there, it can really start to regrow. We have people, especially the knees, we brace the joint, keep the joint gapped so it allows some room for the cells to get in there and grow. We try to get it to maximum medical improvement by doing all this.
Excellent. So this isn't one of the questions, but this is one of the things that you and I talked about. Do you know, you've been doing this for a while now. Are there some people that this won't work for? Now, you mentioned that if it's bone on bone, are there other things that you are red flags and you're going to tell somebody, hey,
Yeah.
this doesn't work for you? Could you expand on that a little bit for us, please?
Yeah, we will not do stem cells in anyone who has been treated for cancer within 5 years. So you have to a 5 year waiting period. There are people who, like, if it's bone on bone, we have to stay away from that. People who have if someone has a lot of issues going on, if they're really run down, they're basically their immune system doesn't work, it's not going to work. If somebody's really, what we've noticed is if someone's really too old, tends not to work. Or if somebody has a past where they've had a lot of cancer, even though they're 5 years past it, and they just had a lot of degeneration, it's just like all the stem cells have been used up and they just don't have it. So we're not gonna, we're
No, no
basically
further.
not even try. We've had a couple of patients in the past where it just didn't work for, and we want to avoid that at all costs.
Certainly. Well, that's good to know that you let us know ahead of time. There was one more issue that we wanted to talk about. It's not one of the questions, but it is an issue that comes up often. and it's the cost. Because, like, from what I understand, it's not covered by insurance in the United States at this time.
It's not,
So
and
what do you
it's
what
not
do you
covered in.
say?
Oh, I'm sorry.
What do you say to someone that says it's about the cost of the this?
Well, it's not covered by insurance. It's not covered by insurance out of the country either. So, uh, basically, what we do is we'll come up with the price of the whole package, and what we do is we offer anywhere from a 10 to a 30% discount, and then basically, if someone's able to pay it all up front, we give them the biggest discount. If they're not, then we work with them. We have a company that will finance it. We also work within the house to do whatever we can to make it affordable through payments and stuff like that. It's compared to what? Compared to having your knee or joint replaced? You're basically
Surgery?
keeping, and when you get a joint replacement done, whether it's a knee or shoulder or hip, it's not a joint replacement, it's an amputation. They're taking out a living part of you and they're replacing it with some metal object. And they're hoping that you're not going to have a reaction to it. They're hoping that the surgery goes well. Like 1 in 200 people die of blood clots from these knee replacement surgeries. So it's a big risk. And a lot of people, they'll get the surgery done. And I know with the knees, some people get worse. And some people stay the same as far as their pain levels. So it's something that you really want to avoid. When you get into the price is into the thousands of dollars, but what compared to having a knee surgery or knee replacement surgery or hip replacement surgery or shoulder replacement surgery, and we've had some phenomenal results with this one guy's shoulder was almost bone on bone, and we did the whole protocol with him, and he's doing absolutely wonderful. He's able to do all kinds of stuff that he wasn't able to do before, and basically pain free. And
It's awesome.
when people experience that, we've been getting a lot of people coming in because they've heard that these results are happening, and they're opting, and the cost is it's a small, basically just a small problem compared to the results. It's
Right.
not even a problem. Once people are able to get into results based thinking, the price becomes little to no object.
Certainly. So let me ask you something. That leads me to another question. How long does it usually take to see results?
We've had people see results within the first day because the cells are so anti-inflammatory that they feel like they got a cortisone shot. And we've had people see results. Typically, that it takes them a few weeks to a month. They start to feel a lot better. The whole process takes anywhere, to 3 to 5 months based on the level of the protocol that we're going to use, whether it's a mid-range protocol or a high
Mhm.
end where we're going to have to use more platelet-rich plasma or more product.
I see. One more question, I guess, or a few more, but is regenerative medicine safe?
It's very safe. It's very safe. The only the only thing it's either gonna work and work good, or it's not gonna work. The cells don't get in there and start basically causing any problems. They're anti-tumorigenic. They don't turn into tumors, and the immune system leaves them alone. Their immune system privileged. So the immune system just leaves them alone because they don't have any external molecules that's going to excite the immune system to go in on an attack. So they're left to their own devices to do what they're intended to do. So the only drawback is it's either going to work or not going to work, and the success rate's a good 80%.
Awesome. Awesome. Okay. Who is a good candidate for regenerative medicine?
Obviously, people who are younger, healthier, we've had plenty of people in their 40s and 50s, and they tend to do the best. However, we've had people in their, 70s and 80s do very, very well. It's just based on the health of the person, the overall health. And that's one of the things that we do is get people on an anti-inflammatory diet for at least a month before we do any of the, regenerative medicine aspects. We have patients come in for at least 4 intravenous nutrition therapies to knock out as much inflammation in the system as possible. We set up with a dietary protocol where it involves supplements and stuff like that. Also, a recipe book that has over 200 different recipes that are, anti-inflammatory in nature. So you can basically put those. You can add some of these recipes. It tells you how to cook the stuff with different types of oils, like non-seed based oils. So, you're eating a lot healthier.
Oh, excellent.
Primes up your overall health before we do any of it.
Excellent. So there another question is, can regenerative medicine help me avoid surgery?
Absolutely. That's primarily what we do it for, is to prevent people from having these major surgeries, or if they've already had surgery, it really helps getting rid of the post-surgical scar tissue and stuff like that.
All right. I become a customer. How long does a typical regenerative treatment session take?
Basically, with the intravenous nutrition, about 20 minutes to 30 minutes. When we do the injections, when Dr. Eric does the injections, it, the room is basically sterile as he can get it. And then it takes about, depending on how many areas of the body we're going to do, like if we're doing
Mhm.
both knees, takes a little bit longer. No, one knee probably takes about a half hour to get the cells, probably about 45 minutes, because we have to de-thaw the cells and the exosomes and stuff like that. And then to do
Mhm.
platelet-rich plasma, he has to get the blood from the patient, and then it takes 8 minutes to centrifuge it, and then time to draw it off, and then it's just an injection into the area. So 30 to
Okay.
45 minutes.
Mhm. Okay. So how do I know if regenerative medicine is right for me? I'm sitting at home and
Basically,
I'm in pain. What might help me with that?
we'd have to sit down with you and do a history, see what kind of medicine you're on, see what your overall health is like, and then do an x-ray of the area to see if it's not
I,
bone
I
on
guess
bone or fused or whatever.
I guess what I'm looking for is so I guess if I'm a person, if I have arthritis or knee pains or joint, is it a joint thing that you're pain, or is it?
So,
It
yeah, well,
seems to me.
it's primarily joint, but we've had people come in and we have done spines. We've done sacroiliac joints in the hips. We actually had, someone who had some hamstring operations done where it was loaded with scar tissue. We just injected the hamstrings and ate up the scar tissue and, reduced a lot of the
Really?
pain, and
Wow.
regrew some of the tissue. So it helps with a lot of different things.
Wow. So last question, how much? And this is the big one. How much does regenerative medicine cost? Generally speaking, obviously. I
Generally
mean,
speaking, basically a mid-level joint protocol that we have is around 4,200 for one joint, and that covers everything. And then the next level up is around anywhere from 6,000 to 6,200, based on, if we need a lot more product because the joint is almost bone on bone. And then if you're going to do double joints and stuff like that, it gets less because we're able to buy the product in more bulks. We get a little bit of a discount. And then we're able to not do the whole anti-inflammatory diet twice, so that it saves there.
all right, that's awesome, Pete. How do I know if regenerative medicine is really right for me?
What we do to evaluate everybody, if they feel as though this is something that is right for them after reviewing and seeing testimonials and various other things. We want to sit down and have a consultation. And the consultation is very important because we're able to determine if it's going to be right for you based on a number of different things. One, if it's a large joint like a knee or hip or shoulder, we want to see that you still have a little bit of cartilage in there and that you're able to maneuver and bend the joint. If you're able to, then the chances of it being a good success is very high, probably around 90%. If the joint is fused, then we can't help you. If you're actively treating cancer, that's a no-no. We don't do that. We want you to be cancer-free for 5 years. If you've had any autologous skin grafts or anything around an area, we don't want to stick a needle into that because the skin grafts are very sensitive and it could, cause the surrounding tissue to fail, as we just, discovered with a current patient. For the most part, if, you know, you're generally healthy, I mean, you may have arthritis and stuff like that, but if you're generally healthy, if you're a heavy smoker, heavy drinker, that tends to you wouldn't be a very good candidate. But if you're severely diabetic, that would be a problem too. Although the stem cells do help immensely with neuropathy, people with neuropathy. So, and when I talk about diabetes, we're just talking about stuff that we can do here. If you have any kind of diabetes, and it's problematic, the place to go is Colombia or Costa Rica. They can reverse all of that, anywhere from pre-diabetes all the way up to type 1 diabetes, where it's the islets of Langerhans that are getting attacked, and it can stop that whole monoclonal T cell aberration from happening, causing the autoimmunity. So that's how we determine if you're a good candidate or not. Not to mention, before we do any of the injections with the stem cells or PRP, we get you on an anti-inflammatory diet for at least a month, and we prep the body up to get it to its highest level of health, doing intravenous nutrition and modifying your diet to eliminate seed oils and stuff like that cause inflammation.
So I'll know your consultation. I'll know whether it's right for me. I'm assuming. All right.
Yes.
That seems awesome. Awesome. All right. Well, that kind of wraps up our people are asking segment, and you heard it right from Dr. Pete himself. And you can kind of base on whether you should be giving him a call. I think you should. And we're going to get ready to go into something we call the local loop. And what that is, it's a segment that we're going to spin as our mystery wheel. So there's our mystery wheel. And there are 6 segments on this wheel. There's the love drop. That's where Dr. Pete gets to share the love with us. Behind the scenes, a pro tip drop, a quick tip or advice, or no, a fun fact or personal something about you behind the business. So what we're looking for here, Connor, is, and you once told me a story about when you first decided to get into being a chiropractor, what made that decision. Why don't you share that fact with us, with our viewing audience today, there, Pete?
Yeah, that's a interesting story. My my mother told me. Now I have a couple older brothers, much older, and by 12, 13 years. And my mother was telling me that you know she wasn't able to get pregnant again, and she went to the typical doctors at the time, and they said that, oh, you have a tipped uterus and all this other stuff, but she wasn't menstruating so well, and she started developing horrible low back pain and leg pain, and she got nervous about that because back in the 70s, the early 70s, they would just send you off to be operated on. So she ended up finding a local chiropractor, and chiropractors back then had only been licensed for like 4 or 5 years in this particular state. So she found one, and it was a woman chiropractor, and she did adjustments and some soft tissue work, and she noticed, okay, I'm feeling a lot better. My low back pain has gone away, leg pain, and she started menstruating, and within a couple of months she was pregnant with me. it's one of those things that kind of pushed me to gravitate towards this profession. So,
It's an awesome story. Wow, wow. So that's why you are here. That's amazing. That is amazing. Wow, that is definitely a personal story. So thank you. I appreciate that, Pete. All right. So moving on. That's an awesome story. So let me ask you this. What can we do to support you? So I know if we want to contact you, we should give you a call or an email. Um, do you have a Facebook page? Maybe we can go and give you a like on.
yeah, we have a Facebook page set up. Oh, geez. That's a
You
good
know what? I'm
question,
going to
Jack.
help you with this because I helped you
Yeah,
build it. And actually, I
yeah,
think you have two here. So you can
yeah.
go see Pete at Pete and Tana Vicker or Leicester Spine and
And
Wellness
wellness.
Center.
Yeah,
So either one of those, go show some love and share that with
yeah.
the
Go.
world because
Yeah, I would opt for people to go to Leicester Spine and Wellness because I'm almost completely inactive with my personal Facebook account. So I just stay away from it. I'm not one of these people, you know, searching for stuff and commenting on social media. So I leave the professionals who do the marketing to their own devices. I don't get into it. I don't even log in or look at any of it really. I just let them do the things that they do. It's not my territory.
well, personally, I would say I appreciate that because when I talk to a chiropractor and he's doing his own marketing, how much is he studying his chiropractic?
Exactly. That's what I
And
like
then
to focus on, doing the things that I do, my primary focus of what I specialize in here.
And that's why we have you on the show because you know what you're doing and you focus on it, folks. All right, Pete, I've been peppering you with questions this whole time. Well, now it's your turn. We call this segment Flip the Mic. And for the next minute, the mic is yours. You can ask me a question, you can give a shout out to someone who's helped you, or say anything you wish more people understood about regenerative medicine or what you do. It's totally your call. Sir, the mic is yours.
Well, the question, and this is a question that is kind of presented to me by a lot of people who have you know concerns, that why doesn't insurance cover this, and why haven't we heard about this more, and why isn't it so, if it's so good, why isn't it being more popularized in the United States? And I think that there's just a big agenda when you look at the amount of money that these pharmaceutical companies have. They overpower any level of advertising that someone like myself would be able to do. The pharmaceutical companies basically have $10,000 per month for every medical practitioner out there. And we're talking, you have a typical primary care office where you have a couple of docs and then you have two or three mid levels. They're able to dish out $50,000 a month in advertising. And then you have Google, who has a vested interest in one of these big pharmaceutical companies. And if you put anything out there on Google for a regenerative medicine ad, they just shut it right down. So
Really?
this is, I know it was supposed to be a question, but it's more or less me
Yeah.
answering a question that a lot of people tend to have. And, I think it's relevant to why you don't see this, making a big, you know, kind of a big disruption in the whole industry.
I heard about that, and the mic was yours. So no, that certainly qualifies because I think it's a legitimate point. And the things that you talk about, Google being involved and the media is involved, and I'm told, and it's hearsay, but I hear that the amount of money that the pharmaceuticals spend on the media is that's why things like this is natural healing. People don't
Yeah,
understand that, they think I think a common misconception because I had it was regenerative medicine. Oh man, you're doing gonna do some whammy stuff on me, right? But then you told me no, it's actually natural healing, which is amazing to me.
it's all 100%.
Wow. Wow. That is, again, that's amazing. All right. So now it's time to make the donuts. You folks remember that back in the 80s? Baker getting up there, right? It's time to get up and go to work. This is our time to make the donut segments where we go to work for our guests and we give them a focused moment to tell you exactly who they help and where to find them. Okay, so what we're going to do is I'm literally going to create this for you folks, and you may hear it again because we're going to turn this into a commercial for Pete. And here we go. If you're dealing with chronic pain, joint problems, or you've been told surgery is your only option, Leicester Spine and Wellness Centers offers regenerative medicine options that help your body heal itself safely and naturally. To learn more, just give us a call at Leicester Spine and Wellness. That's 508-892-8150. Again, 508-892-8150. Or email us at info at Spine and Wellness to schedule a visit and tell them you heard about them here on Voices on Main Street. Now, if you're watching this, it's time for us to make the donuts and you're gonna hear our commercial. All right, I just want to take a quick moment to tell you what makes Voices on Main Street different. If you're watching this episode, it's because you want real answers. And that's what Voices on Main Street is built around, asking the questions that people are already asking, whether they're typing it into Google, asking Alexa, Siri, or even your friends. These are the questions that matter before you spend your time, your money, or your trust. Every conversation you hear on this show is all about clarity, understanding how things really work straight from the people living and working right here in your community. And when you tune in, you're doing more than listening. You're helping shine a light on local voices, the local businesses, and local stories that deserve to be heard. So this conversation is helping you. Stick with us, and let's keep moving Main Street forward together. All right, back to the show. Welcome back. We're going to do our Pass the Mic. Now, if you recall, we started out the beginning of the show with Dr. Pete answering the Pass the Mic question from our last guest, which was, I'm having a brain fart. So rather than thinking about that, I'm going to actually turn the microphone over to our guest and I'm going to ask Pete, what's one question you want to leave for our next guest? Something you'd love to hear another local business owner or community leader answer.
Yeah, my question would be, these people work hard, build up businesses, and a lot of them forget about how important, retirement is. I'd like to know what people have in place for retirement, if they're going to sell their businesses, if they do tax deductible investments towards the end of the year, because it is towards the end of the year where you can take money that you would otherwise pay taxes on and put them into index funds that are essentially run by insurance companies. So it looks like it's an insurance premium. My question would be, what do you have in place, for retirement? Because you're probably not going to, want to work forever. Like very few people do. I actually knew some people in their 80s and 90s and they died still working. So, you know, that's kind of an important question if you ever want to take the throttle off someday, even if you want to just go into semi-retirement. It's important to have a strategy set up. So it's just a question that you should just kind of work in your mind and try to, if you have 20, 30 years left, if you put like 10 or $20,000 in a index fund, you'll probably have $1 million by the time you're ready to retire. Just if it's in good blue chip stocks, just with compound interest.
Great, great. So the question is going to be for the next business owner. What have you done about retiring from your business, or what plans have you made? Am I
Yeah.
correct in that? Awesome.
Yes. Yeah.
Awesome. Awesome. That's excellent. I love that. I love that. All right. Now, what's on Main Street Family? This is where we turn in listening into action. Now, you just heard Dr. Pete share his story, his expertise, and a whole lot of value that most people would normally have to pay for. This is what Voices on Main Street is all about. And it ties right into our Voices for the Voices, where we use this platform to support people and organizations who don't always have a voice. Most local businesses and most local clinics don't have big high budgets or PR firms. They do have a voice. And when they come on this show, we're saying, You matter, your work matter, and your story deserves to be heard. So now, folks, it's your turn to help carry that voice a little further. Here's how you can support Leicester Spine and Wellness Center. And honestly, any local business that you care about, like their content, share this episode with someone who needs it. Follow their page or profile. Subscribe to the show so you don't miss any future conversations. And if you're already a patient or you become one, and this part is huge, leave a Google review. Google review is the single greatest online action you can take for a local business. It helps them get found, it builds trust with new patients, and it costs you nothing but a minute of your time. So go like, share, follow, subscribe. And if Leicester Spine and Wellness has helped you with someone you love, drop them a real, honest Google review and tell people what they did for you. That's what we do here. That's how this community lifts each other up. Now, if you're still here with us right now, first of all, from the bottom of my heart, thank you. Thank you for hanging out with us all the way at the end. And thank you for supporting the show. And thank you for supporting local business like Leicester Spine and Wellness. We like to reward people who stick around. So we call this the mystery gift. Pete, for the folks who made it to the end and are willing to support you, what are you putting on the table as a thank you today?
No, we'll certainly do free consultations for anybody who feels that regenerative medicine is right for them, just to see if we can, determine if they're a good candidate or not. Likewise with the chiropractic, there is a lot of insurance coverage for that. So we'll certainly give you a free, consultation, and we take it from there. We offer per visit. Like if you don't have insurance, we offer per visit fees, and then if you buy a block of visits, you get a very, very hefty discount. So
All right. Well, great. All right. Either free consultation for chiropractic care or regenerative medicine. And you heard from one of the experts in his field. You don't hear a lot about regenerative medicine. The big pharma doesn't want you to. And Pete will give you the straight scoop and skinny. He's not going to lead you astray. All right. For the full story, bonus clips, and more conversations like this, visit voicesonmainstreet.com. Make sure you subscribe. Share this episode with a friend who needs it. Come back and hear how our next guest answers Pete's Ask the Mike question. Pete, thank you again for being here and for the work you do.
thank you,
And everyone
Jack.
listening, we'll see you on Main Street. Thanks again, Pete.
Anytime, Jack. Thank you.